All right, hello everybody. This is Dave Gaines, president of the Sacramento Autistic Spectrum and Special Needs Alliance. For those of you who don't know, we are a relatively new and very small nonprofit organization in Sacramento, California, serving autistic and other special needs children and their families in the greater Sacramento area. Um, I wanted to put out this brief message. I think it's important. This is regarding California Senate Bill SB 946. This is a mandate for private health insurance companies to cover applied behavior analysis, ABA, programs for individuals on the autistic spectrum. I'm sure many of you are aware of this bill. Um, it passed and it's starting to go into effect now. Some of you may already be experiencing changes. Um, If not, you probably will soon. For those of you who already have ABA programs paid for by the regional centers or other ways, you may be finding out from your insurance company, and so you may be transferring however you're currently paying for your services to the insurance plans that you may have. Um, so this bill was a big deal, and basically, as some of you may know, I'm a behavior analyst myself. I'm a member of the California Association for Behavior Analysis. Um, I don't agree with everything they stand for or promote. Um, Today, I attended a webinar put on by the California Association for Behavior Analysis, CalABA for short. The webinar was the second of a series. I did not catch the first webinar. So this is the first one I've seen. And they're putting on a series of webinars for behavior analysts regarding this Senate bill, the health insurance implications for behavior analysts, and training for behavior analysts to know how to work with the insurance systems, how to begin getting their services covered by health insurance, um, so on and so forth. So I attended this webinar today. Uh, it was I came away with some interesting, concerning information. Kind of surprised. Some information I was not aware of. Some information I don't think most people were aware of. I want to keep this message short so that most people will listen to all of it. Um, so basically, um, a few things that I got out of this webinar that I wanted to mention. One, uh, as most of you know, this bill is only a mandate for private health insurance companies. It doesn't cover public, like Medi-Cal or whatever. But in terms of private health insurance companies, if your private health plan is self-funded, sometimes called AFO, this bill does not apply to it. Um, the self-funder, usually your employer, may have the ABA benefit attached to it or not. Um, but if it is a self-funded plan, this bill does not require the ABA to be there. If it's direct from the health insurance, then it is required. Now, I believe, I've never had a self-funded plan, but I believe they look very similar. So self-funded plan is funded by the employer, but I believe you just get the network of providers from the health insurance company. I think everything looks the same. I believe the cards basically look the same, and you think you may have Blue Shield or whatever, and you may have providers from them, but it's self-funded by your employer. So I'm not exactly sure on that, but you may want to check to see if you have a self-funded plan or not. Check with your employer, check with the health insurance company. Um, Again, if it's self-funded, this bill does not require those plans to cover ABA. Um, there also appears to be complexities in who is going to be providing services under the health insurance covered ABA programs, who they accept as providers, who ends up providing your services. if you have a current provider and you switch to insurance, you may have to switch to another provider, and that can have deficits. That can be, you got to change providers, new people in your home. Your kid has to go through this change, and we know that changes for autistic children can be more difficult. And you got to go through the whole new team has to assess your child and build rapport with your child, and that can sort of set services back a little while they do all that stuff. So there's some concerns with that. And there's complexities with all that, and there appears to be a lot of complexities and different things to understand in regards to this bill and coverage by insurance companies. Um, I don't think it's quite as wonderful as we thought it was, or that we were told it was, or that it looks like superficially. I know I've spoken with some parents of autistic children. They have concerns. They're freaking out about what's going to happen here. They're already encountering difficulties, being told they may have to change providers, other things like that. I know they're not happy with those things. So the main point that I wanted to communicate to you, and this is what really concerns me, this bill appears to be good for, um, conventionally the term is higher functioning autistic individuals. I'm not a big fan of that term. I prefer less autistic, but uh, these folks who don't qualify for regional center services will now be able to get applied behavior analysis services if they have a private health insurance plan. So in terms of increasing access to ABA for autistic individuals, it appears to be a positive thing for those individuals, again, that are higher functioning or less autistic, as I prefer to call. Um, but for those folks who do qualify for regional center services, who already have regional center services, so these are going to be the more autistic children. Conventionally, the term is lower functioning. Again, not a big fan of that term. Um, But for these folks, if you regional centers are payers of last resort, meaning you have to go through other resources before the regional center will pay for your ABA services. So if you have private health insurance, you're going to be required to switch to private health insurance because that's your first option now, and you need to use that um, before the regional centers would look at paying for your services. So you're going to be forced to change. So you're going to be forced to go through this possibility of having a provider change, go through all these complexities, figure all this stuff out. Um, that's probably a moderate burden, and that's not the worst of it. The real concern is if you are switched to a private health insurance plan, which you're going to have to do if you have one. Regional centers will quit paying for your services, and now you're going to have to pay like you would for any other service that you get off of your health insurance plan. So you're going to have to pay your premiums, you're going to have to pay a deductible before your health insurance kicks in and cover the ABA. If you have a deductible, you're going to have to pay your co-insurance. So if your health insurance covers 80% of behavioral health procedures, you're still going to have to pay for 20% of your behavior analysis services. If you have a copay, meaning you have to pay per visit, copay is what, $10 to $50 per visit. You're going to have to pay that. And that means if you, every day that you have a tutor come or someone come to work with your child at home or center-based, I suppose, if you're getting those services, you have to pay the copay of $10 to $50. Let's say your child gets ABA 5 days a week, regardless of the amount of hours. That's 5 copays a week. If that's $50, that's $250 a week out of your pocket that you have to pay in copays. So, and you have to exhaust your deductible if you have one. If you have a $1,000 deductible, you have to pay the first $1,000 before this would kick in. So families who are getting completely free services from the regional centers are now going to be forced to go to the insurance companies and will have to pay, could be considerable amounts, to get their services. This is very concerning. This doesn't seem like a very positive thing for families that are going to have to go through this, and that's a lot of families. While it may be a positive, the bill may be positive for some families who don't qualify for regional services, regional center services. There appears to be a very negative aspect for families who are already with regional center and going to have to switch to their health insurance plan if they have one. Um, and it appears, according to what was said during the webinar, the Cal-ABA representative said that the regional centers will not pay for these co-pays, for these deductibles. It's going to fall on your shoulders. If you can't pay them, are you going to be left without services? This is a big concern. This really concerned me, and I was not aware of any of this. I don't think most of us were aware of any of this. I don't think we were told about this. We were told about all the other aspects of the plan that may be positive, but we weren't told about this negative stuff. Um, Now, my concern is, well, is that true? Do the regional centers, can they not, can they bail out of paying these costs that families would have to pay for their health insurance premiums, co-pays, or you know, deductibles, so on? Does the Lanterman Act require services to be free for families? So, according to Cal-ABA, regional centers are not paying for these fees that now families are going to have to pay for. I would be interested. I'm not sure. I would have to do the research, find out, contact the regional centers, look at the Lanterman Act, find out if that's really going to be the case. And please, if any of you know information on this or want to contact the regional centers and find out, and you do find out, or you know some information about the Lanterman Act, contact me. I'll give you the contact information at the end of my message here. Let us know. Um, so this is very concerning, that last part, especially there with families having to now start paying possibly considerable amounts for their services that up until now have been completely free thanks to the regional centers. That concludes the bulk of my message. I just wanted to add in that other than the health insurance industry, most organizations supported SB 946, including Autism Speaks, FEET, and Cal-ABA. Um, these organizations were all for this bill, including most organizations. Most people were for it. How come these organizations didn't tell us about the negative consequences for some people? Um, why was no one telling this? Everyone was promoting this. This is great, you know. Yet these important details were not being touted to us. Why not? Why are these organizations not giving this information out to everybody? Um, do we have to be concerned about the accuracy of the information coming from these organizations? Yes, I think so, and this falls in other cases as well. You're not getting accurate information in multiple situations from organizations like Autism Speaks, FEET, so on. Um, uh, And what are the motivations? Why not? Is there monetary motivation? You had behavior analysts teaming up with organizations. There's obviously money in this for behavior analysts, so of course California Association for Behavior Analysis is going to be for this. Um, these organizations are often working together. Um, what is the motivation that we were not told about these negative consequences? I think these are valid questions, and I think we should be concerned about this. And you know, we many people tend to just blindly give their support to these organizations, think we need to take a critical look at the mainstream organizations out there, the information that's being put out there. I just want to say our organization, Sacramento Autistic Spectrum and Special Needs Alliance, we've only been around. We just had our 1 year anniversary, so we were not really involved in any of this. We didn't support it. We weren't against it. We just really didn't do much in terms of it. So SASSNA did not play a role in disseminating information regarding the bill. Okay, this is the last slide. Response and contact information. Feel free to give your responses to this. SASSNA and myself are definitely interested in hearing them. We would like to hear your feedback, any information you may have, experiences you may be having. Maybe we can, as an organization, as a group, mount some sort of response or have some sort of discussion regarding this. So please, I would recommend joining the SASSNA email discussion list, open email list for discussing different matters. There's a lot of good information that goes on there. There's quite a few families, individuals, professionals on there. There's the link. It's a Google group. You can sign up and participate. You can also stay in touch with SASSNA that way if you're not already in touch with us. There's a SASSNA email address, which happens to be my email address. You can send emails there, and the SASSNA phone number, 916-877-5220. We're a small organization, all volunteers right now, very small budget. So that phone will likely be answered by me, but it will likely go to our voicemail. Go ahead and leave a voicemail message. You will get a call back, or just leave your thoughts on the voicemail if you want to give your thoughts and you don't necessarily need a call back. That's fine too. So please, here's the contact information. Get in touch with me, with SASSNA. Let us know your thoughts and experiences. Thank you for listening.